Dr. Chia Shilu.
Question 24, please.
Mr. Speaker, over the last 5 years, one person under the age of 18 had undergone a cosmetic surgery procedure, namely a double eyelid creation, in our public hospitals. MOH does not track cosmetic surgeries done in the private hospitals. The Singapore Medical Council's Ethical Code and Ethical Guidelines stipulate that minors, defined as those under the age of 21, have to obtain their parents' or legal guardians' written consent prior to undergoing invasive procedures. This requirement applies to both public and private hospitals. For aesthetics procedures in particular, SMC's ethical guidelines also stipulate that doctors must give patients a cooling-off period to reconsider their decision before proceeding with the treatment. Also, they must not offer aesthetic procedures to minors unless independent professional assessment indicate that these procedures are truly in their best interest. MOH's assessment is that these safeguards are appropriate.
Dr. Chia.
SMS for his replies. Just two supplementary questions. I think number one, would the ministry consider actually collecting data on plastic surgery done on minors, 18 years and below or 21 years and below, in the private sector as well? I think you understand that the impetus for this PQ came from a recent newspaper report where some private plastic surgeons actually did mention there were significant increases in the number of minors seeking plastic surgery, and then even with their parents' support. My second supplementary question is whether the ministry would consider, in addition to the ethics codes and various guidelines for cosmetic procedures, whether they would consider coming up with guidelines specifically for plastic surgery in minors. Because if you look at the literature, the reasons for plastic surgery in minors versus adults can be quite different. For example, in minors it's more to fit in adults more to stand out. That's just one example. And also because minors are still growing, the risks are also different, right? It may affect their development. So I think it's a special group of patients, and I just would like Ministry of Health to consider looking at this. Thank you.
I'd like to thank Dr. Chia for those two suggestions. As to the first one, whether we'll consider collecting data of minors undergoing aesthetic or cosmetic surgery in private hospitals, we will look at this suggestion. And as for the guidelines for cosmetic or aesthetic surgery for minors, I think we will consult the Academy of Medicine whether this will be feasible.